is the approval of the minutes from our last meeting on October 16th. I will do the motion. Do I have a motion to approve the minutes from?
So moved.
Second.
So Dana made them approved and seconded by, I didn't catch that. Who was-
Ronnie Allen.
Dr. Allen. Thank you, Dr. Allen. All those in favor?
Aye.
Opposed? The minutes are approved. We'll next go to the public comment. Do we have anyone registered today, Cynthia?
No, no one registered.
Okay, thank you. We'll move now to the executive director update. Michelle, tell us what's been happening.
Well, thank you very much. And most of what I'm going to talk about today is the results of our open enrollment. So last night at midnight concluded our open enrollment for the 2024 plan year. And this year we just blew everything, out of the water. I mean, it's just amazing results all around. So our total enrollments are the highest we've ever had in the history of the exchange, at 213,895. And as I recall from when rates were filed last year, I believe the individual market is about 239% or 239,000 rather. So obviously we have a lot more new enrollments, but we're getting a lot of enrollments through the marketplace, which is exactly what the intention of the marketplace has been, to really give folks a place to come, compare, look for their doctors, help find affordable coverage, and enroll. So total enrollments up 17%. Now, even better news, our new enrollments are up 64%. So we had over 56,000 new enrollments this year. We do know that a portion of those are from Medicaid, people that have moved off from Medicaid. We're still validating the exact numbers, but we know that that had an impact. We also know that the continuation of the expanded tax credits, the enhanced tax credits, has had a significant impact. It's really made insurance affordable for people to purchase. So other interesting tidbits with financial assistance, again, is up, and that we don't have my percent right in front of me because I changed it, but with financial assistance is up, without financial assistance is up. We've got the 18 to 34-year-olds up over 56%. I mean, that's phenomenal. That's telling us that, again, insurance is affordable. The young adult subsidy is working. Dental plans, we don't often talk about dental plans. They're kind of just out there and we let people enroll in them. But those are up 15% too, and over almost 75,000 Marylanders have purchased dental insurance through the exchange. What's really exciting is the areas that we have focused to try and get more enrollments. We have seen consistently, and again, these numbers are hot off the press, but we're seeing that in our focused areas in our counties where we've really put extra effort, because we know those counties either have more people are uninsured or they have lower incomes in those areas. Percentages are all up double digits. I don't have anything in any county less than a double digit, which is really exciting. So we're still digging through all the data. It's brand new, it's just out, but it's just amazing. And for those that, I'll just give you some sense, for those that rolled over from Medicaid, and again, we're still evaluating these numbers, but we had over 14,000 enrollments come from Medicaid. So that's really, really good. And I did find my percentages on with financial assistance up 18%, without financial assistance up 14%. So everything we're seeing all over is really significantly up, and especially in those areas in the counties that we focused on, and in the populations we focused on, and in getting the Medicaid rollover. So I want to give a huge shout out and much gratitude to all of our staff, to the call center. The call center just had numbers that we've never seen before. I mean, 12,000 calls on one day, 12,000 interactions. And, you know, they've had a challenges we talked about, getting staff, keeping staff, and they just did a remarkable job given these numbers and given the last few weeks of the enrollments of getting people assistance that they needed. Our producers, our navigators, our application counselors, everybody that was on the ground helping people get enrolled. It is amazing. It all really shows how that laser focus efforts have really paid off this year. So tomorrow we will be having a press conference. We hope that, well, we know we'll have the press conference in the morning. More information will come out, but overall, everyone in the board who supports all of provides our governance and oversight, you all should be incredibly proud because we've done a really, really fine job this year. So kudos to everyone. Just a couple other things I'll update on. We are now in session. So session kicked off last week and full steam ahead. We don't have any departmental bills that we submitted this year. Johanna will talk a little bit later on about a technical bill change that we're going to be putting forward, or we will support. There will be sponsors in both the HGO and the Senate Finance Committee for the Young Adult Subsidy Program. Our budget hearings are on Friday, March 1st and Monday, March 4th. So those are scheduled and we look forward to that. We will, once we understand what is coming out of the governor's budget and what we think the legislature will do, we'll look at any changes we need to make internally to adjust accordingly. And federal updates, we again, as everyone else, is waiting for what will happen with continued funding at the federal level, the federal government. We continue to be assured that any of the operations that we have will not be impacted by a government shutdown. So we are hoping that continues. And then I just want to close out with, we do have a promotion for one of our employees, Tisha Payne, who joined us not too long ago as the HR manager, has been promoted to HR director. And we're thrilled for that. Jocelyn Stamp, who you may remember, went to work for the Attorney General's office. We are equally excited for the Attorney General's office because she'll bring just a lot of expertise and a lot of good guided focus that will help them, I'm sure. So congratulations to both and welcome, Tisha, into your new role. And I'll stop there if there's any questions for me.
Michelle, oh, I'm sorry, Ben. A couple people had their hand raised. Sharon and Laura Crandon, just wanted to let you know about that.
Very good.
Thank
Thank you, Michelle. Certainly on behalf of the board, we all applaud the work of the staff and all of the contractors that play key roles in making all this happen. It does seem as though everything really clicked this year. And I wanted to, in particular, call out Tamara Gunter, who does support to consumers that are having problems. I actually sent a couple of people her way myself, and her staff really responded quickly and efficiently and got these people answers. I'm sure it reflects, the service that she provides to everyone who's needing their assistance. So the staff should be particularly proud of all the work this year, and on behalf of the board, thank you very much. So I think board member Crandon had a question.
Yes, thank you. I had two questions. One is, can you equitably compare year over year the young adult subsidy, given the changes that we made? Is that, or is there some adjustment that'll be made when the final numbers come out?
Yes, we can tell what the growth was in that population for 18 to 34. We also have an 18 to 37, but that was a new growth. So we're kind of keeping apples to apples and looking at the 18 to 34. But yes, we have all those numbers, and the 18. The sheet I have right now is not broken out by that, but we can certainly.
No worries. I just wanted to make sure that we're able to track apples to apples year to year over year, but plus be able to track the adjustment that we made based on the vote that we made on expanding.
Absolutely.
Okay. And then last question was about service metrics, given the capacity, these remarkable numbers, whether you were able to meet your service level agreements for the citizens or the population, I should say, to make sure that there was capacity to
Right.
feel.
So the call center is I think what you're referring to. Is that correct? Yes. And again, depending on which day it was, sometimes the service level was not met. But if you look over the course of the open enrollment period, it was, we did okay. I think we have a couple different tiers. And for tier 1, over the enrollment period, the speed to answer calls was less than 3 minutes, which, is we expect during open enrollment that it will be a little higher. So again, overall, I think managing what we do with the PHE unwind, the unknowns, the volume increase in calls and the growth, I would say that the call center handled it quite well.
Other questions? Cynthia?
Had just Vice Chair Stefan, I just wanted to mention that there is a closed meeting summary that needs to be read for the meeting, and you should have been provided that, I believe.
Oh, right. Sure. So I can go ahead and read that now.
Yes. Please.
Okay, go ahead. The MHBE Board of Trustees will meet in closed session for the purpose of discussing pending procurement protests and
I'm
appeals.
sorry. That's not that there was a one for the previous meeting. Cynthia, was that provided to the Vice Chair?
Yes, after you sent it to Laura, forwarded to you, Ben. Let me look and see if I can find it. I'll send it to you.
Okay, so we can continue on until we have that for
Okay,
you.
all right, very good. The next item is a board committee reports. The only report we have is from the Finance and Audit Committee, and board member Crandon and I attended. Just very briefly, the meeting was on November 16th. We had presentations from the staff on the finances for the board. We also heard about a emergency procurement that was presented for approval. That particular procurement was for the replacement of the air handling unit at the board facility on Pratt Street. The staff was in compliance with the procurement requirements for the state. 3 bids were obtained, and the bid most advantageous to the state was selected. We also heard a compliance report from Scott Brennan, who provided us a status update on the Office of Legislative Audits that are done periodically in all state agencies. So this is the MHBE's lucky year to have OLA assessing financial compliance. There have been, as of that date, Mr. Brennan told us there were no concerns presented to the staff. We'll wait for the final report to conclude that there were no significant findings. And we also discussed something that's near and dear to everyone's hearts, SOC 2 reports, which are a type of security audit And Ms. Atta reviewed with the board members present the nature of those and did note that they accept the SOC 2 report typically, but they may not always be relevant. We considered other comparable certifications and accreditations, particularly the FedRAMP authorization conducted by under auspices of the federal government, and MHBE has deemed that this level of authorization is acceptable for this particular vendor. And lastly, our attorney Sharon Merriweather presented the board gifts and grants policy to the Finance Committee. The committee adopted that policy, supported that policy. I think that's going to be presented today. Is that correct, Sharon? To the full board. So stop here with any questions. Board member Brendan, do you have any additions or any observations you'd like to share?
No, thank you.
Okay, thank you very much. Moving on to the actual policy. Our attorney Sharon Merriweather is going to review that with the board. Jumping ahead here. Yeah, I think that's fine. I'm going to, Sharon, while you're talking, look for the notice that Cynthia's sent me. Go ahead.
Okay, that's going to be presented by Johanna, I believe. So we'll let her continue on. Thank you.
All right, go ahead, Johanna.
Oh, and Cynthia's sharing slides. Great. So as Ben mentioned, the Audit and Finance Committee reviewed a proposed gift and grants policy at their most recent meeting last year. And I'm here and approved it for a presentation to the full board. So I'll be presenting on that today. Next slide. So just as a little bit of background here, not on this slide, but we were approached by a participating carrier last year that was interested in making a donation to MHBE to use to generally support our marketing efforts. And that led us to realize that we didn't have a kind of policy in place to accept gifts. And so that set us down this path of putting together a policy related to accepting and soliciting gifts and grants. And you see the product of that here today. So just as background, the board does have statutory authority to apply for and receive public and private funding that includes gifts and grants, and is also authorized, the exchange is also authorized to solicit gifts and grants by following certain ethics laws, specifically state ethics laws. Any funds accepted as gifts or grants have to be processed through the normal budget process. And then the policy that I'll be sharing today overall does not apply to federal grants, which are in a category of themselves. This is more related to private, non-federal gifts and grants. Next slide. And just the policy statement is here. I won't read it verbatim, but it just states that we would follow regular budget processes and abide by the state ethics law in soliciting, accepting, and spending gifts and grants. Next slide. So the process we propose is to accept a gift or grants is that first the executive director would vet the offered gift or grant to ensure that it poses no risk of reputational harm to the exchange and doesn't raise other concerns. We're proposing that the board would delegate to the executive director the authority to accept a gift or grant under $50,000 without board consultation, except in 3 circumstances. If that gift or grant is offered by a vendor or partner of the exchange, if it entails a cost to the exchange, either initial or annual, of $5,000 or more, or if it's a gift that's not in the form of currency, like if someone wanted to donate property or a vehicle to the exchange. So for any of those three scenarios, even if the value were under $50,000, the executive director would seek board approval prior to accepting the gift or grant. But assuming the gift or grant is under $50,000 and it does not fall into one of those accepted categories, and the director deems it appropriate to accept it, the director would then report on that accepted gift or grant at the next board meeting and would be responsible for ensuring that the money is used in accordance with the terms of the gift or grant. Next slide.
Just to let you know, Dana just raised her hand.
Oh, yes, Dana.
Actually, it's more of a comment. For item number 3, big thumbs up to that. Especially since it's a public board meet, or it's open to the public. But as a courtesy, it would be nice if she or he or whoever, but right now it's Michelle, could include report the gift in her weekly emails to us, just in case we're in our networking or in our our networks, someone who knows about it mentions it, we won't be thrown off base. That's all. Thank you.
That's a great suggestion, Dana. I'm certain we could accommodate that. Next slide. So switching from accepting a gifts or grants to soliciting a gift or grant, the process that we propose is that board approval would be required prior to any solicitation. And then the rest of these kind of stipulations are in accordance with the state ethics law. So the solicitation would have to be broad and not specifically targeted at vendors or entities that the exchange regulates. It would have to be clear that donations wouldn't confer any special benefit with relation to the exchange. They couldn't result in personal benefit to any of our employees, and employees involved in regulatory or procurement matters related to the entities being solicited couldn't be involved in the solicitation. Next slide. Then just to wrap up on the solicitation kind of provisions, we'd consult legal counsel prior to launching any solicitation to ensure ethical and statutory compliance. The executive director would send the donor a written acknowledgement of that acceptance and keep a copy for at least 3 years. And we would share that with the DBM upon request. Next slide. In terms of allocating the funds received, the exchange CFO would submit the funds to be processed through the regular budget and budget amendment appropriation process, and no spending of those funds would be done until appropriated. Yes, Dana.
The funds, I know they will be listed in the budget and in financial reports, but how will they be presented in the report? And depending on the answer, I'm going to make a suggestion.
I'll defer to Tony on that one.
Thank you.
I'm not really sure what you mean, Dana.
Well, let me tell you what my suggestion is. Someone who's worked with budgets in terms of trying to get money from a as a nonprofit or whatever and sending it to foundations or whatever, there are these tricks of hiding funds within miscellaneous. And I was going to suggest that we make it very clear and transparent that we say XYZ Corporation grant 100,000, whatever it is, make it a line item and be transparent.
Right, I agree with you. I mean, sometimes a potential donation will say to be used for marketing but we still have to go through. So in the income portion of the budget, we'd have the grant. So yeah, I don't really like the use of miscellaneous also. So I agree with you there, and thank you for the suggestion, and we will do that.
You're welcome. Thank you.
Next slide, please, Cynthia. Okay, and then I kind of reviewed this on the previous slide in terms of when board approval would be needed. So in all instances, if the gift is valued at $50,000 or more, and then as I previously mentioned, if it would cost the exchange $5,000 or more to kind of accept the gift, if it's not in the form of currency, if it's offered by a vendor or partner of the exchange, and then if it's under $50,000, but would result in the total annual amount donated by that donor exceeding $50,000. So if we were to get multiple donations in a year from the same donor that cumulatively hit that $50,000 threshold, we would come to the board to seek approval. Next slide. And so because we're proposing this as a board policy rather than a motion, we have a resolution. And I'll defer to Sharon on how to proceed with the resolution.
So generally the board chair or vice chair would read the resolution to be voted on by the board members.
Thank you. I think I can do that. The resolution of the Maryland Health Benefit Exchange Board of Trustees approving gifts and grants to the exchange, solicitation, acceptance, and spending policy. Whereas the Board of Trustees of the Maryland Health Benefit Exchange wishes to establish a policy governing the MHBE solicitation, acceptance, and spending of gifts and non-federal grants in a manner that is fair, transparent, and in accordance with the applicable state law. Now, therefore, be it resolved that the Board of Trustees hereby adopts the Maryland Health Benefit Exchange Board of Trustees gifts and grants to the exchange solicitation, acceptance, and spending policy, which is actually attached in your materials as Exhibit A. All those in favor, say aye.
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 Opposed?
Aye.
You have your resolution. Thank you. Thank you, Johanna.
And I just want to double check, we got votes from all present board members. We don't have any quorum concerns.
I don't think we have any quorum concerns at this.
Okay.
We have 6 board members, so we have quorum. We could do a roll call if you want to make sure that we have all votes. I didn't hear anyone abstain. It's a little hard to hear all 6 ayes.
Yes, and it does look like our board members are all still in attendance from.
Okay, great, thank you.
So we're staying with Joanna, don't move. We're going to now consider the young adult subsidy program. I know board member Crandon, excuse me, had some questions and we're all excited to hear more. Go ahead.
Yes, happy to share this. So wanted to provide an update on the status of the young adult subsidy program. I know that Michelle has been sharing updates on this in her weekly updates since December, but I have more to share. And as you've heard, it's been a great year for enrollment. So 2024 is the 3rd year of this 4-year pilot program. It launched in 2022. So we've got 2 full years completed and then, just about 2 years ahead of us. The board is required by statute to establish the eligibility and payment parameters for the subsidy program, and we're statutorily authorized to provide $20 million per year in subsidies. That funding comes from our state reinsurance fund, it's set aside for the young adult subsidy program. During open enrollment, our staff work with our actuaries at Lewis and Ellis and with the MIA to monitor our enrollment and our projected annual costs daily to keep a close eye on if we're approaching that $20 million threshold. Next slide. So back in November 2021, as we were gearing up for the program's initial launch in 2022, we discussed a process for closing the program with the board if it looked like we were projecting to hit that $20 million spending amount. And the process that the board approved in November was that we would coordinate the tracking of enrollment and projected costs in consultation with the MIA, which, as I mentioned, we continue to do. The director, executive director, would provide a regular update to the board, as Michelle has been doing, and that when the projected cost reaches 19.5 million, excuse me, staff would take action to close the program to new enrollees. That means individuals who have, enrolled with the subsidy would continue to receive it during their enrollment for the remainder of the year, but anybody new who were coming to Maryland Health Connection to enroll after the program is closed would not even see the subsidy available to them on their plan shopping screen. So it would be sort of invisible. It would have disappeared from our site and they would not receive it when they enrolled. Our system has the ability to implement that the evening that we make the decision. So if today we were to decide we needed to close the program, that system change would go in tonight, and then tomorrow it would no longer appear on the site. Next slide. So this hasn't been an issue in the first 2 years of the program. As you can see in the bottom 2 rows on this table, our 2023 and 2022 program costs were both under $14 million. So we did not approach the $20 million threshold at all, did not have to contemplate closing the program. Those actual costs did end up coming in below what we had projected those years. And I think largely due to the impact of Medicaid redeterminations being suspended, it was just hard to gauge how that would impact the program, but that reduction in folks flowing from Medicaid into the individual market did suppress our enrollment during the public health emergency. So going back to these projections for this year and walking through this table, you can see that, and this data is as of Friday, so it's not our most recent data as of yesterday, the 15th. We should have that today, but we didn't have that in time for the board meeting. So this is data as of Friday. So we had 15,700 enrollees with an estimated 2024 cost of about $19.4 million. So not quite that 19.5 kind of closure threshold. However, we've incorporated into these assumptions, into these projections, assumptions that reflect that a portion of the individuals who enroll don't end up actually paying their first month's premium and effectuating their coverage. So we have some enrollment that is almost like phantom enrollment. They enroll, but then they never truly get into coverage and therefore don't incur subsidy costs. So if we incorporate in both the enrollment we anticipated between the 12th and the 15th, as well as those who don't end up effectuating, that pulls about 2,000 individuals out of our open enrollment projections, which reduces those costs by about $740,000, leading us to an estimated total cost for enrollees who come in during open enrollment of about $18.6 million. That effectuation data will come in between now and the end of the month. So by the end of the month, we'll have complete data for folks who effectuated coverage for January 1st. People who enroll between January 1st and January 15th, they don't have coverage that starts until February 1st, and we wouldn't have their effectuation data until later in February, but that's a much smaller cohort of our enrollees. So we'll have the vast majority of kind of relevant data over the next couple weeks in terms of that effectuation number. We anticipate if the program remained open for the remainder of 2024, you can see in the estimated future special enrollment program that we'd get an additional about 17,600 individuals enrolling through special enrollment periods. And that total cost would, in subsidies, would be about 4.3 million. That is lower than you might at first glance expect, because these folks, by virtue of being special enrollment period enrollees, are coming in at some point later in the year. So we're accounting for a different average estimated months of enrollment. This includes people who might enroll in October and only have a few months of coverage, and so incur a relatively small subsidy cost because they're just enrolled for a short period of 2024. So altogether, if the program were to remain open the whole year, we estimate we'd have a little over 66,000 unique individuals receiving the young adult subsidy at a total cost of 22.9 million. So to rewind and compare that to what we had anticipated in spring when we presented the 2024 parameters to the board for approval, we'd anticipated total enrollment of about 52,600 individuals with the total cost of just under 18 million. The reason that our projections are now exceeding those that we had in the spring is, of course, in the spring, we didn't really have data on how the Medicaid unwinding was going. And it's kind of through the last few months of this year, and then particularly during open enrollment, we've seen just much stronger enrollment than we had anticipated, which is a great thing for the market and for meeting our goals as an exchange. We've long targeted increasing our young adult enrollment. Young adults are the age group most likely to be uninsured in the state, and getting them enrolled is good for the market because they have on average lower claims costs. So they bring down premiums for the market as a whole, and they're also good for the reinsurance program because these individuals are eligible for EPTC, so we're getting federal pass-through funding for them, but they're less likely to have reinsurance claims. So for many reasons, it's great that we're having a banner year for young adult enrollment, but there is the challenge of the funding. So if we can move on to the next slide. And so I mentioned some of this in my comments just now. These numbers are slightly out of date. As I shared earlier, and as Michelle shared, our young adult subsidy enrollment among 18 to 34-year-olds is up actually about 41% year over year. And that's outpaced our overall enrollment growth, which I think is actually between 17 and 18% now. So we're seeing clearly very strong growth in those young adults. In addition, our young adult enrollees 18 to 34 who are under 400% of the federal poverty level, that's the subsidy eligible group, account for a larger share of our total enrollment this year, up from about 17% to approaching 21% this year. And again, as I mentioned, that's great news because as those young adults are a larger portion of the market, it should be good for everyone in the market in terms of lower premiums. Next slide. So a few other considerations to share. We know the Medicaid unwinding is continuing through April, so we're going to continue to see those folks leaving Medicaid and transitioning into the individual market. We don't expect the rate to be as high because the state did prioritize individuals who appeared to be more likely to to be eligible for individual market coverage earlier in their process of redeterminations. Nevertheless, we still, part of the reason that we recommended to the board that we make the eligibility changes in the spring was to provide that softer landing for individuals as we go through this unprecedented process of moving people out of Medicaid after COVID and trying to keep them in coverage. Also, as I previously noted, we underspent our first 2 years budget by an average of about $6.5 million a year. So we have a cumulative underspend from the first 2 years of the program of about $13 million. And because of that underspend in calendar year 2023 and the way the state fiscal year works, we actually have $12.7 million in subsidy funds available for the first 6 months of this year. That's more than enough to cover our projected costs for the first 6 months. But where the problem comes in is in the next 6 months of this year when that resets and we have the 20 million again. So 2 items that we wanted to share for board discussion. And I'll actually start with the second one and provide some updates there, which I know Michelle has also shared over email, but we've been in touch with the legislative leadership, including for Senate Finance and House Health and Government Operations Committees, as well as the governor's office, to discuss a technical change to the young adult subsidy legislation that would authorize the board that would allow the rollover of unspent funds from prior years to be used in future years of the program. So that would make the 13 million that we didn't spend in the first 2 years available for calendar years 2024 and 2025, which, given that for 2024, we anticipate about $23 million in spend, should be more than enough to get us through this year and also provide plenty of cushion for next year. So we had favorable reception from everyone we've talked to, because this strong enrollment data didn't come in until late in the year. It's not a bill that would move forward as a departmental bill, meaning we formally kind of submitted it to the governor's office in advance of session. But nevertheless, it looks like it is likely to move forward kind of under the auspices of the legislature. And we're excited that that's gotten a positive reception from everybody. So wanted to share that update with the board and also just, take the board's temperature on that idea. Yes, Dana.
Go ahead, Dana.
Sorry, I didn't know I pushed it, but I was thinking some things. I personally support that. I encourage my colleagues to discuss it and consider supporting it too. But my question is, can we ask, or would it be too much to ask, if we could somehow get the legislation, not necessarily this particular legislation, but get the legislature to expand the program with funding, maybe another 5 years, another 10 years, or something like that, or in perpetuity, because obviously it's working, it's making a difference. And if we didn't have those young people insured, can you imagine the cost to the taxpayers? So anyhow, let me throw that out.
So we are tasked with submitting a report to the legislature on the outcomes of the program by the end of the year. So we'll be working on that and look forward to using that as an opportunity to kind of show with data how the program has performed. And then I anticipate that will be a topic of conversation next legislative session, because the program will end at the end of 2025. So if the legislature wants to pick it up or continue it, they can make that decision in the 2025 legislative session, and we'll have all the data including, data through this open enrollment for them to review.
Other questions?
And Laura has her hand up.
Go ahead, Laura.
Just a question, what the alternative is until such time there is relief in the next legislative session. What is the alternative for that gap in funding?
So for the technical correction to allow us to roll over funding, we're hoping that bill will go through this session. So it would be in place by mid-April at the latest. Hopefully sooner than that. And the board, I think, has two choices here. We can proceed with closing the program to new enrollment when we project calendar 2024 costs are going to hit 19.5 million as previously directed by the board. The board could alternatively make the decision that they wanted to allow the program to remain open, given that we do have funding available through June, but that would be sort of counting on the fact that the legislation will pass and that will be set up for July and the remainder of the year with the rollover funding available to us. So if that legislation were not to pass, we could still cover our costs for 2024, but it would mean that we'd be going into 2025 having sort of overspent for the first 6 months of the state fiscal year and giving us less than $20 million to spend in 2025, which would of course not be ideal.
Johanna, could we go back to slide number 4? Cynthia, can you move us backwards? If not. That's it. Oops, it's not numbered exactly the same, but the first question is, how realistic do you think the 17,000 new enrollees is? That's a 35% or about 30, looks about 35% to of what we have now. What's the basis for that? I mean, yeah, I agree that there's going to be special enrollment individuals, and but I was curious as to how solid you think that number is, because that is really the tripwire here, is it not? And we look okay right now.
Yes. I think it's as solid as it can be. It's based on last year's special enrollment numbers with adjustment to account for the fact that last year in the first half of the year, we didn't have Medicaid redetermination. So our special enrollments were suppressed for basically January through June because of that. So we've modestly adjusted to account for increased special enrollments kind of in 2024 because of that. And again, the whole unwinding has been somewhat of a curveball and hard to project. So with that caveat, I'd say this is largely based on last year's data.
And I wasn't clear. So there's 13 million in unspent funds from previous years. That requires legislative action to free that up. We don't have access to it. It's just kind of sitting in a MHBE account, but not spendable. Is that?
Yes, it's in the reinsurance fund, but it's not spendable on young adult subsidies because of the way the legislation is currently written. We can only spend $20 million per year on subsidies.
Okay, thank you. And third question, my last one is, when young adults disenroll, would we, if we had to make the hard decision of closing the program, would we have a wait list, or how would we handle individuals that came on through special enrollments, but because of would there be any provision as people left, perhaps getting employment through or insurance through an employer, et cetera, would those people that are quote unquote, using my term, waitlisted, would they have a chance to qualify, or is it once it's too administratively complex to try to figure that out? It's if you didn't get in, the fund is closed and the fund is closed.
So I think it would be administratively complex to sort of retroactively award young adult subsidy to people who enrolled after we closed the program. It wouldn't be complex for us to reopen the program to new enrollment once it's closed. So if something, if a bunch of young adults left the market and suddenly we had more funds available than we had projected, I think we could pretty easily reopen the program, and anyone who enrolled from that date forward could then again receive the young adult subsidy. But that does kind of leave people who chose to enroll in that interim period somewhat disadvantaged.
Yeah, that's what I was thinking of. Thank you. What do other board members think? Any thoughts?
I like the idea of actually seeing if we could use some of the unspent rollover funds. What's the likelihood of the legislature not approving that?
We have support from the committee leadership. So, and we also spoke to the speaker's office. So I feel good about the chances.
Johanna, has the bill been drafted? It's probably a pretty straightforward bill.
It's a pretty straightforward bill. It's just a sentence, I think. It's been submitted by the committees to DLS. So we have an initial draft that DLS is reviewing.
And I mean, there's two factors in legislative action. One is timing of the introduction of a bill, and the second is importance, but timing cannot be discounted because some things that are good ideas just come in too late. So I think we're okay. Other thoughts about, I thank you, Dr. Allen.
Dana's hand is up.
I actually have a question. It's great to hear that the legislature's leadership supportive. Is the anticipation that the governor, if there were an issue, that he would be supportive too, or would I'm assuming he'd be supportive, or is it just too early to guess? Or maybe we need Secretary Scott Herrera on the phone, or we need to know. But anyhow, do we know?
Well, I can't speak for the governor himself, but we did speak to our legislative contact in his office, and she was comfortable with the bill.
That's good, thank you.
And I'll just add that the reason why everyone is comfortable with it is it's not new money. It's already existing money that we have. So it's not general funds. It's not any new fee. It's already what we already have. It just has not been spent. So it was already accounted for, not spent. And then everyone really does understand the impact that young adults make to the risk pool. So we have not had any, everyone thought it was a wonderful idea. Just sharing that.
I would agree with Dr. Allen that we should take all steps to try to free up that funds, because it does look like it would be needed. I think as the executive director characterized, it seems like it's widely supported in the both governor's office and the General Assembly. So I think we would be wise to take advantage of that, in my opinion. All right. Let's
So
move.
if I can, I just want to flag that it is possible that we could hit that 19.5 million prior to a bill being approved. And so based on the direction from the board in November 2021, we would still proceed with closing the program. And then once the bill was approved, kind of, discuss with the board reopening the program, unless the board has other direction.
Joanna, if you could look into, is there a way to put those people who kind of fell through that during the interim period, would they be requalified once funds became available? I know you said it may be too complex, but I think in terms of fairness, and we have the funds, we should at least make an assessment of how difficult it would be.
Yes, absolutely. We can look into that.
I have a question. I don't know how the language is shaping up, but because it would be changing the formula of the reinsurance reallocation, is there some kind of cap or allocation as to where and how, if it opens up now to this population, of how the disbursement of that happens if it were to change the formula?
So the legislation wouldn't change the payment parameters authorized by the board for 2024, which are the 18 to 37-year-olds under 400% FPL, kind of with a phased out subsidy as they move up the age and income brackets. That, excuse me, that wouldn't change. And it wouldn't materially affect the reinsurance program because that money had already been kind of planned to be used for the young adult subsidy, that rollover money. So it would not need to change the reinsurance parameters either.
So that 13 million didn't go back into the general pool. There's some set aside restricted piece and would that remain, or would the language, I just want to make sure it would allow that 13 or any future money to go back into that general pool, because that too could change the distribution.
The 13 million did kind of went back. It was never really pulled out of the reinsurance fund. General money is kind of set aside for the reinsurance fund. So it's been in there. We didn't need to pull it to pay for the young adult subsidy program. So it's just remained in the overall state reinsurance fund. The language would allow 13 million from the reinsurance fund to be used for the young adult subsidy program because we didn't use it in those first 2 years where it was authorized for use. I'm not sure if that's answering your question.
Just making sure that that I understand if it's there and restricted, sort of like a restricted grant, I get it. But if it's went back into general and there were overruns in the past, how do we know that 13 million is still kind of there and available for any future monies specifically for this population, or does it get kind of absorbed into the general pool and that kind of changes the formula somewhat?
Do you want me to?
Yeah,
Go
ahead,
Please, Tony.
Yeah, this is non-revertible fund. So basically these funds do not revert back to the general fund. So these funds are specifically for the purpose of reinsurance and cannot be used, unless legislatively they're redesignated, but right now, we don't lose the funds.
Thank you, Tony.
Okay.
Board Member Grandin, did that answer your question?
That's helpful, yes.
Thank you. All right, Johanna, anything else we need to do on this? You have your sense of the
Yes.
board? Okay.
Yes, thank you.
Thank you. So you're up next with some regulations on our federal conformity policy and final regulations. This is the Johanna's meeting, I think, today. So go ahead.
This is my closing act, and I'm going to try to make it speedy. Okay, so We are bringing forward to you final regulations that the board voted to approve back in the September meeting. And now we had our 30-day public comment period following board approval. That's in addition to an informal 30-day public comment period that we hold before we even bring the proposed regs to the board. So we've gotten the round of public comments that came in after the proposed regs were published, and we are now bringing them to you for a vote to approve. We are only suggesting one, what I think is fairly minor change from what we brought to you as proposed. So I'll run through that now. Next slide. So as a refresher, these regulations are largely to bring our state regulations in alignment with federal regulations. The federal government annually releases updates to their regulations, typically finalized in the spring. So this was our analysis of the spring 2023 federal updates, things that we wanted to do to bring our state regs into conformity. A quick run through of those items, clarifying that dependents can remain on their parents' plan until the end of the year they turn 26, as opposed to the end of the month. This is already practiced by all of our carriers, so it's maintaining the status quo, but just clarifying our regulations on this point. Giving consumers 2 years to resolve a failure to file and reconcile their federal taxes. When consumers receive premium subsidies, they have to reconcile those on their federal taxes. If they don't do so, the exchange is then supposed to deny them APTC until they correct the issue. Currently, that is supposed to kick in if they haven't reconciled their most previous single year's taxes. The feds are changing that to kick in only if there have been 2 consecutive years where they haven't reconciled. Increasing the number of essential community providers that our carriers must contract with to 35%, up from 30%. Essential community providers are entities like FQHCs, federally qualified health centers, and other entities that serve predominantly underserved lower income communities. Our carriers largely meet this 35% already, so we don't anticipate a significant impact from this. Clarifying that plan variant marketing names must be correct and not misleading. Requiring that notices of payment delinquency from carriers go out within 10 days of the delinquent payment. And then for individuals whose plans are not being continued at the end of the year, so that the carrier has chosen to discontinue that plan, there's a hierarchy that determines what plan that individual is auto-renewed into if they don't actively choose a new plan for themselves. And the goal is to match them to the most similar plan. That hierarchy is set out in federal regulation. Previously, plan network was not considered specifically in that hierarchy. That's being added as one of the elements to kind of track people into a most similar plan. Next slide, please. There are also a few changes to special enrollment periods. One is to give consumers more options when they're losing minimum essential coverage, such as coverage through an employer, and they're using that opportunity to enroll in coverage through the exchange. This is giving them kind of more flexibility in the start date for their exchange coverage. The second update is to allow individuals who are specifically losing Medicaid or MCHIP 90 days after their loss of coverage to enroll in an individual market plan, up from the current 60 days. And the last is a simplification to the situation where the exchange incorrectly displayed information about a plan, just making it simpler for consumers to claim an SCP to change their plan or enroll in a plan in the case of that exchange error. Next slide. And then apart from those federal conformity proposals, there was one policy proposal that wasn't necessarily related to the federal changes that we tucked into here. This came out of a recommendation from our 2022 affordability work group, which was a stakeholder work group that we convened to look at options for improving affordability and the consumer experience on Maryland Health Connection. And they had recommended that we limit the number of plans per carrier per medal level to 3, starting in plan year 2025. We currently limit the number of plans that a carrier can offer at each medal level to 4 plans. So this is a reduction from 4 to 3. We didn't anticipate a significant consumer impact if carriers, when we looked at this at the time, if carriers chose to eliminate their plan at each medal level, to the extent they even have 4 plans per medal level, which many of them don't. But if they took the 4th plan with the lowest enrollment out on the individual market side, that would affect about 2% of enrollees who would then need to be crosswalked into another plan. We had originally proposed in the proposed regulations to apply this 3 plan per medal level limit to both the individual and small group market, but this is the one change that we're proposing for the final regulations, which is to apply this only to the individual market, not the small group market. We received comments that recommended that we not make this change on the small group side, and there are several reasons. Small employers are much more likely to be working with a broker when they enroll, so they're more likely to have advice kind of guiding them through the enrollment process, less likely to be sort of doing it on their own and facing what could be a potential overwhelming number of choices. And I should back up to say the reason for that reduction from 4 to 3 is because there's a lot of research that shows when consumers are faced with a high number of choices, they end up suffering from what's called choice overload and are more likely to either throw their hands up and just not complete the process of enrolling, or to choose a plan that's not actually the best plan for them. So we got comment that's less of an issue in the small group market. Also, we're working to build our small group enrollment platform with an anticipated launch in spring 2025. And so we're trying to do everything we can to make that platform and our small group offerings enticing to small employers and the brokers they work with. Off exchange, there's quite a plethora of small group plans, many more than 4 per medal level being offered by carriers. And to the extent we further diverge from what's available off exchange, we may incentivize brokers and employers to look at off exchange because of that increased choice and kind of greater ability to tailor what they're looking for their business. So given all of that, we recommend just maintaining the current 4 plan per medal level limit in the small group market. And the next couple slides, I think, or slide go over the public comments we received kind of in written and verbal, 2 of them relating to the plan limit issue. One from Aetna requesting that we keep the 30% essential community provider threshold, not increase that to 35, with the argument that we have a more extensive list of what's considered an ECP in Maryland than the feds do. We did a crosswalk of that list and determined that it's not substantially different between Maryland and the federal government, and we shared that crosswalk with Aetna. So we recommend continuing to move forward with the 35% threshold, and that is, I think, it from me on this presentation.
Thank you, Johanna. Any questions? Cynthia, do we have any hands raised? I don't.
No, nobody.
So just one question for you, Johanna, on the ECP list. Do we have any data on how much utilization the ECPs provide to the exchange insured populations? I assume we don't have any reporting requirements on ECPs regarding what impact this requirement actually has.
We don't have that utilization data, but we did just in the last month update our MOU with MHCC that will allow us to use APC data to look at that question.
Yeah, I would encourage you to do so. I think we have staff that would be interested in it too at MHCC, so thank you. All right, let's go to the motion here. I move to approve the final regulations as presented and authorize MHBE to submit the final regulations as presented to the Department of Legislative Services for publication in the Maryland Register on January 26th to go into effect February 3rd. Do I have a second?
Second.
Dr. Allen, seconded. All those in favor?
Aye.
Aye.
Aye. Opposed? You have your regulations, Johanna. Go ahead. Next up. We have a procurement issue presented by Tracy Gamble and Venkat. Proceed, please.
Yeah, thank you. Good afternoon, Vice Chair, members of the board and everybody. Today we are going to request the board to approve the procurement of our Salesforce licenses. Prior to that, I would like to give a very brief account of what is this platform for us and then hand it over to our procurement manager, Tracy Gamble. As you probably already know, the Salesforce platform that MHBE is utilizing for managing several critical functions. The number one being the CRM, the customer relationship management solution that the call center uses. And over the years, we had expanded the system to meet variety of our requirements, internal requirements, as well as integration with HBX applications such as producer operations application and carrier data integration systems are all integrated with our HBX system as well. And in the recently last year, we did more integration on live chat, and we built a portal for the appeals team, and we are planning to expand these local applications further to cater to our other business functions as well. However, the predominant bread and butter for Salesforce continue to remain as the CRM solution. And with that brief introduction, I will hand it over to our procurement manager. Tracy.
Good afternoon,
Next.
everyone. Next slide, Cynthia. So the slide before you is basically a cost comparison for 2023 costs and the 2024 costs. In 2023, we actually spent $1,150,977.85. And this year's estimated cost is $1,450,916.55. Now, the difference in the cost is mainly due to the increase in the Service Cloud Enterprise Edition licenses, in addition to the data storage. In addition, I think the next slide is going to actually show the Salesforce Shield that we actually added this year as well. So that makes up the difference in that basically $300,000 difference in costs.
Yeah, thank you, Tracy. I would like to briefly talk about the Salesforce Shield. This is a security enhancement from Salesforce, and we would like to implement this for enhancing our security for our platform. Obviously, as we navigate through an era of heightened digital threats, this suite of tool is very pivotal for safeguarding our sensitive data and ensuring compliance. There are multiple components, as you could see here. The one important component is the platform encryption. This component secures our critical data at rest. Even if in the unlikely event of a security breach, our data remains unreadable and secure. This is kind of definitely a required feature in any software that utilizes consumers' critical data. And the second component is something called event monitoring. This provides us with comprehensive visibility, tracking of who accesses what data, when, and from where. This isn't just about security, it's also about understanding how our system resources are being utilized, and provides us opportunity for realizing more operational efficiency as well. There are field audit trail functionality that this particular tool offers. That's basically our time machine, allowing us to track changes in data over an extended period of up to 10 years. So it's not just about knowing the current state of our data, but also understanding its history. And this is invaluable for audits and maintaining any regulatory compliance requirements as well. And we are also looking at within the same tool, something called transaction security that enforces real-time security based on the rules that we set. If something out of the ordinary occur, like an unusual login attempt, for example, we can trigger immediate actions, either alerting us or outright blocking the activity. So in a nutshell, this Salesforce Shield is not just an add-on to our existing license, but it's a comprehensive, proactive approach to safeguarding our data ecosystem within the Salesforce platform. And implementing this is, I think, in my view, is a forward-thinking step in securing our data and our operations.
Thank you, Venkat. Cynthia, if you'll go to the next shield. So the procurement method that was actually utilized was the Intergovernmental Cooperative Purchasing Agreement. We issued a task order request for quote for a 1-year base with 2 one-year renewal options. The license period that we're asking the board to approve is March 2nd, 2024 to March 1st, 2025. And the approved reseller is Carasoft Technology Corporation. And as previously stated, the cost of the 2023 license was $1,150,978. The cost of the 2024 license is $1,450,916. Next slide. MHBE requests the board's approval to enter into the Intergovernmental Cooperative Purchasing Agreement, ICPA, with Carasoft Technology Corporation for a base period of 1 year with 2 one-year renewal options, and award contract to Carasoft Technology Corporation in the amount of $1,450,915.90 to procure Salesforce licenses for the period of March 2nd, 2024 to March 1st, 2025.
Thank you, Tracy. And I will read the motion, which repeats basically what Tracy just read to you, but I move that the MHBE enters into the Intergovernment Cooperative Purchasing Agreement with Carasoft Technology Corporation for a base year period of 1 year with 2 one-year renewal options, and that a contract award is made to Carasoft Technology Corporation in the amount of $1,450,915.90 to procure Salesforce licenses for the period of March 2nd, 2024 to March 1st, 2025. As presented. Do I have a second?
Second.
Dr. Allen seconded. Questions? I did have one. I'm not sure if this would be Venkat answering, but if you look at the breakdown, there's multiple cloud-like charges that appear sprinkled throughout. Not looking for a long answer here, but the cloud-like line items seem to be 3 or 4. Is that, can you give us an explanation why cloud services are disaggregated in that way?
Sure, Ben, Tracy, if you could please move back, sorry, Cynthia, if you could please move back by a couple of slides, one more. Yeah, thank you. So the first one, Service Cloud Enterprise Edition and Government Cloud, that's the core number of licenses that we require for our call center team and also for our internal MHBE technology as well as business teams. So these licenses are the high cost licenses that pretty much has all the functionalities. And if you go down to the next one, the Service Cloud Enterprise Edition Flex uses is a lower cost license that we use it during open enrollment for staffing up quickly. If call center needs more licenses, we use those licenses. That's only limited for a specific period of time and specific number of usages within the time. So we use that so that we don't have to increase the cost on the larger licenses. And the partner community members licenses, for example, when we give to our producer application, that's slightly different license with limited access, and also the cost is lower. And when you go to community login licenses, that could be we would give those accesses to, for example, our MDH staff and few other organizations as necessary in terms of number of logins. And that's also attracts much lower cost. And the sandbox is actually our so-called stage environment where we test like how we do it in production. That always has a higher cost associated with it because of data. And then additional data storage we have asked for this year also has slightly higher cost. When we apply the security, Salesforce Shield security, it applies to all of these individual buckets for these licenses. And that's why you can see the incremental cost in all of these line items. And if you look at the industry trend, the SaaS, the software as service license cost compared to 2022 and 2023, it's almost 8% increase last year. Thankfully, our procurement team could manage it, the cost down a lot. The SaaS cost is almost double the CPI, the Consumer Price Index, that we see around 4%. So this is, in my view, we have a reasonable cost thanks to our procurement team's negotiation skills.
Thank you for your thorough explanation.
Thank you.
Other questions?
How does this fit into the budget, either the Salesforce line or the enterprise license line?
That's a great question. So we, I will let our CFO to expand further on it. So we have a separate line item for Salesforce, and that we, in fact, it can be combined under enterprise licenses, the MHBE's enterprise licenses outside of MD thing. However, we have a line item for Salesforce, and this attracts 75% federal funding and 25% state match. Tony or Major, if you have anything to add, you could please.
Yeah, the only thing I would say is that basically the licenses, software is broken down into three categories in our budget. And the first category is Salesforce. That has a budgeted amount by itself, and then the enterprise software are software like Akamai, Corticon, all the other enterprise software that we use. And then thirdly, the third category for license costs are license costs for MD Think. So I hope I answered your question.
Yeah, I see that. That's why I was asking, just making sure this was in the Salesforce line
Right.
and in line with what was budgeted for 2024, based on what I was looking at.
Thank you.
Thank you.
All right, I think we're ready to vote. All those in favor, say aye.
Aye.
Opposed? You have your TO RFP approval. Now we'll turn to another contract matter, the Consolidated Service Center contract modification. And Tony and Tamara are going to be presenting. Please proceed.
Yes, sir. Thank you. The Consolidated Service Center At the May 2023 Board of Trustees meeting, the board approved $16.1 million for the consolidated call center costs for fiscal year 2024. And due to the public health emergency unwind, the call center vendor has incurred additional cost scope with the original contract. And these additional costs are incorporated into 3 contract modifications. And they're modifications number 5, 7, and 8. And the 3 contract modifications span 3 different time periods in state fiscal year 2024. Okay, so the first call center modification is mod number 5, and it revises billing and staffing to support the PHE unwinding during the period of March 2023 and September 2023. One thing, well, the costs covered under this mod include initial scale-up training and nesting, personnel for Saturday calls, monthly license costs, which basically Salesforce, which we just went over, is one of those costs, and special project staff and associate financial analyst. One thing I'd like to note here is that the time period straddles 2 fiscal years, fiscal year 2023 and fiscal year 2024. The total estimated, and I emphasize estimated costs, were $1,033,352. And because it straddled 2 years, and the data we had back when we went to the board in May, we felt confident that the FY24 costs that were going to be incurred through this modification 5 were included and could be included in the 16.1 NTE amount that the board approved for fiscal year 24. So we didn't feel any need to increase our NTE due to this, because of this mod. Okay. The second mod, go ahead, Sen, you can please. Okay. This next mod is the modification number 7, and it covers a time frame from September 1 to October 10th. And the cost under this modification included some initial scale-up training and nesting, additional staffing for the New York project, and personnel for Saturdays, and monthly license costs. For this modification, the total estimated costs are $1,273,506. And MHBE is requesting that this be added to the cost consolidated service center, not to exceed cost. Okay, Sen, next, please. The last mod, the third modification, which impacted our call center costs, is modification number 8, and it covers the time frame from October 1st, 2023 to February 29th, 2024. The costs covered under this mod include some initial scale up training and nesting, additional staffing due to attrition, training, and nesting, the personnel for January 14th and January 15th, which yesterday was Martin Luther King Day, and monthly license costs, and special project staff, and the associate financial analysts and Q&A analyst staff, and so some computers and related items. The total estimated costs, and again, I emphasize estimated costs, are $2,581,912. MHBE is requesting that this mod also be added to the consolidated service center, not to exceed amount. So go ahead, Sid. So here's a summary of the numbers. So the May 2023 board meeting, The expected not to exceed amount for FY 24 was $16.1 million. We'd like to add additional NTE of $1.3 million, and I rounded that up. I didn't. Modification 8 is $2.6 million for a new and revised not to exceed amount of $20 million for FY 24. And again, just like Salesforce licenses, there's a split between federal costs and state costs, and the estimated federal funding percentage is 60.2, and the state funding is 39.8. So if you wanted to say it's 60-40 split, rounding it up, we could say that. Okay. The request for approval, and I don't know, Ben, if you want to read this and
So
question.
recognizing we're a little behind, we'll just do it once.
Okay. Do you want to do it?
Yes, I'm going to do it.
Thank you.
I move to approve modification numbers 5, 7, and 8 for the consolidated service contract and increase the not to exceed amount of to 19,951,665 for FY 24 as presented.
And
Question
Dana
before
has her
we
hand
vote.
up and Singh has his hand up.
Yes, for, I think it was modification 7. There's mention of a New York project. I mean, I can guess what that means, but I don't know what that means. So
Yes.
why are we paying for a New York project?
So it's not a New York project, it's a New York, we call it the New York project, 'cause that's where the staff came from. So that's why we call it a New York project. The staff came from
Gotcha.
a New York project. And we needed that staff to maintain the staffing levels, that we had to do 33% above the staffing levels for the forecast. So that is why we had to make sure we have the appropriate staff. So that's why it's called the New York project.
Okay, that's good. That's good to know, and thank you. I
No
would
problem.
suggest,
Just 1 second.
I know for you, it makes sense, New York project, but anything until I knew, or until we all knew, it'd be nice to say staff based in New York or something like that.
Yes, ma'am, understood. Thank you, Dana.
You're welcome.
Question, thank you for that answer. The other question I had was, it's a significant increase, despite the 60-40 split between state and the federal. Do we have those funds available in our budget?
We just submitted a federal as needed APD, and we will have to file a deficiency with after approval of this for the state funds.
Is there a possibility state may not be able to provide us those funds? I know the budgets are very tight right now, and the governor has talked about how much deficit they're projecting for next year.
I would venture to say, because it's the public health emergency unwind, that I can't speak for the governor, but I would think that would be unlikely for, so that's what I could say about it. I would think it's highly unlikely that it would be rejected. But I guess, anything's a possibility. Even though it's a remote possibility.
And what are the consequences if these funds were not approved or not available?
Well, Tamara funds to cover the costs for between now and the end of the fiscal year, and the calls are coming in. The call centers numbers are significantly higher than last several years. So do you want to take that, Tamara?
Yeah, just, I mean, I think if I could add a corollary to that question, and that the additional cost is largely triggered by the increased demand, the use of the service center. Is that right, Tamara?
Yes, so due to the public health emergency, we had a significant higher number of calls and things we had to do to support MDH through this process for the PHE unwinding. So again, like Tony said, I highly, it's unlikely that they won't approve this because, this is like a national thing, the public health emergency unwinding, and they want to make sure that no one got left behind or no one fell, in the cracks. So it's just unlikely.
Thank you.
You're welcome. Any other questions for me?
Yeah, I would ask one, and I understand that the board has not met since October, but in some cases, the funds have already been spent. Is that correct?
We've received invoices. The two of the mods were basically were just finalized. The monies have not officially been spent. We've received invoices for part of mod 7.
Okay. Thank you.
Okay.
Other questions before I call for a vote? Hearing none, all those in favor?
Aye.
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 Opposed?
Nay.
All right, we have one opposed. Let's move on.
And I'll just interject here. We can pull the strategic plan update and put that onto February. So we're running a little short on time, and that's an option.
Let's do the IT roadmap with Venkat, and then we can make a call on the strategic plan and what people's availability is. If you're actually at your office, it probably will get colder, and we want to send everyone home safely. Venkat, proceed.
Thank you, Vice Chair. Next slide, please. So I want to very quickly give an overview of technology. When we say technology, what for the exchange, what we mean by that. We have our host of applications: consumer portal, worker portal, broker portal, marketing portal, presumptive eligibility portal, and also the stakeholder MHBE.
Hey, you were calling me?
And also a variety of
Yeah, we have some feedback. Please mute your phone. Saying your phone is on. You need to mute. Okay, thanks.
And other web services, as Michelle pointed out in earlier presentation in the executive director's update, the traffic was significantly higher during this open enrollment, almost 15% increase on the website and more than 22% increase on the mobile devices, and overall 20% increase on our entire web applications portal, with more than 1.1 million mobile app downloads this year in total. It's a significant enhancement of technology services this year. And our live chat, actually, we had approximately 61,000 chats in contract this open enrollment, and the Broker Connect application was used more than 9,000 times. And we had a new channel called Secure Messaging Channel, where more than 4,000 cases had been resolved for the consumers. And as I pointed out earlier, CRM is our bread and butter, and we have, since inception, almost 8 million tickets had been handled through the CRM. And during this open enrollment alone, we had nearly 400,000 tickets were handled. And so the scope and scale of the technology over the years had been expanding. And in terms of the number of accounts, as you could see, catered to a large number of accounts over the years, with notices and documents sent to the consumers exceeding 55 million over the years. And all these IT functions noted here are in-house through the IDIQ contract, as you are aware of. And except only the exception is the MD Ping support that we receive for hosting our certain application, including our consumer portal on the MD Ping AWS platform. So everything else, rest of them come under our technology. And over the years, we have been expanding for more automation, more integration. And this year, a beginning of the artificial intelligence technologies, which I will talk about briefly as well. Next slide, please. So when we talk about strategy for technology, how do we come up with our strategy for the year? There are several feedback and input mechanism, and the number one obviously is the MHBE strategic plan that has a significant component for the information technology as well. And our annual IAPD document that we submit to CMS for funding that has a roadmap for the year for how we are going to implement Medicaid policies and also how we are going to make any changes to our technology. And we also seek feedback from our policy for operations, compliance, marketing, and other functions, and meet our regulatory and consumer experience requirements as well. And we have a forum called Work Management, where MHBE works closely with MDH, DHS, and internal stakeholders to elicit system requirements, long-term and short-term as well. And also we seek feedback from carriers, brokers, and other stakeholders for QHP-related policy and system requirements. And thanks to our marketing team, we also take feedback from the assessments as was performed this year as well on the user experience testing initiatives as well. And last but not the least, our MHBE technology priorities. We have close tie-up with our Gartner research partner, and we work closely in understanding the technology and the industry trends. And also internally, we have a systems architecture group that I chair, also provides a lot of technology feedback to set up a strategy for the year. Next slide, please. So in a nutshell, from the 50,000 feet view from the top, what do we want to achieve for 2024? Besides meeting federal requirements, state requirements, policy implementations, operational requirements, etc. So number one, continue to be cybersecurity as it should be. As the board may recall, we implemented the Zero Trust Security framework last year, and this year is going to be a continuation of that with more AI-powered security monitoring. We will be dipping into that as more and more AI evolve for wonderful things. We also will see more and more threats to our systems. And business continuity is going to be our focus, and more awareness and training related for our staff in understanding security is a component as well. And number two is innovation. And I will talk briefly in the next slides about AI. And we continue to empower consumers through a variety of engagement channels, as I noted earlier. So we will continue to look at those channels. For example, live agent chat, when we implemented last year and integrated into our consumer portal. We did not really expect the amount of the number of traffic that would come through the channel and how call center would support that channel. And it has been phenomenal for us during our PhD unwinding as well as during the open enrollment this year. So we will continue to engage with our consumers through a variety of channels. And this year we are going to expand our data analytics platform, which is kind of primitive right now in terms of providing reports and dashboards, but we would provide opportunity options for our policy team, for example, to look into the data in depth and analyze how certain policies could have impacted our consumers, or provide insights for future policy settings as well. And there are several technology initiatives we are planning this year as well. And we will continue to collaborate with MDH, DHS, Controller, Labor Department, and other agencies that would like to work with us in terms of integrating our systems. We continue to work with our carriers in terms of trying to achieve a real-time enrollment with our carriers. We are a little bit successful on that, but we would like to expand that further this year as well. Last but not the least, the operations. One of the key initiatives for the exchanges to build a disaster recovery capability that we are working with the MD Think team. Under the new administration, we do see significant improvement in terms of collaboration and openness to listen to us and engage with us. So thanks to that. And we will also be working with MD Think to migrate the lower environments to MHBE's AWS platform to improve on our efficiency. And last but not the least, in terms of operations, I think we are at a stage where we would focus on the so-called site reliability engineering, which is basically to create scalable, highly reliable software systems with a focus on reliability. And anytime we introduce new features, we would need to maintain the system stability and reliability, and integrating more automation and capacity and performance efficiency would be key for this year as well. Next slide, please. So in a very high level, again, landscape-wise, technology landscape-wise, infrastructure and security, more AI integration, infrastructure migration to MHBE AWS. And in terms of consumer engagement, more AI-induced tools. And in terms of solutions, building solutions at scale and speed, we will be improving our DevOps and data operations and automation side of things. And also in terms of providing a unified digital experience, we will use our UX test results and our expertise in providing a unified experience across channels. At this time, I'm going to talk very briefly about the AI, as we all talk about AI now, and I'm sure you are aware of Governor Moore's executive order to meet this AI moment, requiring the state to begin its work to ensure the use of AI in Maryland state government in a responsible, ethical, and beneficial and trustworthy way. And thanks to Michelle, we at the leadership level, we did have multiple conversations. We started with my initial presentation on AI technologies, and then we had a deeper discussion at the leadership level. And also we had a leadership retreat on AI, specifically looking into potential use cases and how those use cases can be ethically and responsibly be implemented through AI technologies. And we also set up a internal leadership team for drafting an AI policy that would align with states' potential AI policy that we are expecting soon. And also we had a discussion, thanks to Michelle again for arranging that, with our Do It secretary, as well as our senior advisor for the states for responsible AI adoption. And our initiatives, as well as the state's drive towards this, all align. And we could see that from the executive order as well, in terms of emphasizing on fairness and equity and privacy and safety, security, and resiliency and reliability, transparency, accountability, explainability, etc. So our thought is to approach AI with caution, but we are not going to be afraid to innovate, but we will thoroughly vet at a very high level, at the senior staff level, for any use cases that we would implement. And also we will have a robust AI policy that would align with state's AI policy as well. And next slide, please. So this is a quick view of the roadmap across various streams, something called special project stream enhancements, M&O, maintenance and operations releases, and a Salesforce stream. Every month we have a release across these streams. And in fact, we are almost implementing things every week. The scale and speed at which we are implementing technology changes is pretty fast. And thankfully our systems are built that way. And as we bring more and more automation into our fold, we will be able to do more seamlessly as well. The next slide, please. So at the end of the calendar year, what do we want to see at a very high level? Besides implementing all those initiatives, we would like to see enhanced consumer access through integrated conversational assistance, meaning a chatbot inside our consumer portal, which is already there, and which is also empowered through the ChatGPT integration to respond in the natural language already. And we will be expanding that to assist consumer to easily navigate through the consumer portal when they apply for coverage. And we would use AI assisted tools for more cybersecurity monitoring and alerting. And in order to enhance our resiliency, we would build a disaster recovery capability, which is already underway. We are working closely with them. They think on that. And also we will be migrating our lower environments to MHBE AWS cloud. And last but not the least, as I said, AI integration for carefully vetted technical and not technical use cases would be the prime theme for this year. I would stop this rapid presentation at this time and open for questions.
Thank you, Venkat. Do we have any questions from the board? I just have one. In terms of the AI related activities, do you have any estimate on what that's going to cost in 2024? Any idea even?
So at this time, so Stefan, what we are doing is utilizing our existing resources in terms of resources. Or the only component change would be technology change. For instance, when we integrated a GPT powered, the large language model powered Flora chatbot, we utilized our existing license and partnership through Do It and Microsoft, and we use the same licenses. So the costs were only incremental at this time, but down the line, when we adopt more robust AI solutions, I am thinking there may be a cost attached to it, but at this time, we are not aware of any clear estimate on cost, but we will definitely weigh on the cost and stay within the budget.
Thank you. Other questions? Hearing none, thank you for a very exciting presentation for the coming year. And we'll look forward to periodic updates as we move in.
Thank you.
So Michelle, what is your preference in terms of the strategic plan? We are almost at our allotted time.
It's entirely up to the board. It's an update, so there's no action that has to be taken on it. So we can go through it today, or we can hold it for February.
What's everyone's preference? We do have a closed session to follow.
No, that has been removed.
Okay, so it's does
Sharon's raised her hand.
Yes, I know, Sharon. I have to read the closed session summary. I was putting that in to the very end. It seemed like the flow would work better, but
I recommend February for the strategic plan to give it sufficient time.
I agree.
I agree.
okay.
I do too.
I think the majority of the board has spoken. So we'll look forward to Mr. Ratner's presentation in February. The presentation is in your mailing materials already, so I'll confirm that with Secretary Herrera Scott that I can tell you to be well versed in the strategic plan for the February meeting. With that, before we conclude, let me read the closed session summary. The board met in closed session on December 20th, 2023 at 1:42 p.m. via conference call. The purpose of the meeting was to receive a litigation update from legal counsel and to discuss and decide on steps forward in the pending legal matter. The members who voted to meet in closed session were Dana Wexler, Kathleen Bahrain, Rondell Allen, Aika Aluk, Laura Crandon, and Singh Taneja, and Ben Steffen. The individuals in attendance at the closed session were Dr. Herrera Scott, Dana Wexler, Kathleen Bahrain, Dr. Allen, Aluk, Laura Crandon, Dr. Taneja, Maria Pilar Rodriguez, and our legal counsel, Sharon Stanley Merriweather, and Ben Steffen, and of course, our very trustworthy Assistant Cynthia Wilson. The majority for the authority for the closed session was under general provision, Article 3-305B-7 to consult with with counsel to obtain legal advice. The board actually discussed the pending legal matters and how to proceed with the pending legal matter before the board. During the meeting, the board voted to approve the closed meeting minutes dated July 18th, 2022, September 19th, 2022, and January 17th, 2023, and September 11th, 2023. Maria Pilar Rodriguez was not present for the votes to approve the minutes. Dr. Laura Herrero Scott, Laura Crandon, and Aluk abstained from voting on the approval of the minutes dated July 18th, 2022, September 19th, 2022, and January 17th, 2023, because they were not on the board for those meetings. The board also voted on how to proceed administratively on a legal matter pending before the board. Lastly, the meeting was adjourned by general consent at 2:30 p.m. That meets the requirements of the open closed meeting authority. And with that, I'll take a motion to adjourn.
I move.
Dana
And
motioned, and who seconded?
Singh Tanasia.
Dr. Tanasia seconded. And with that, have a very safe trip home if you're not at your residence now. And we will, our next meeting in February, we'll look forward to the strategic plan from Mr. Ratner, and we'll all be very carefully reviewing that in the interim. I want to thank the staff again, as always, for a very complete, well-organized and thorough agenda, and wish everyone a nice week and safe travels. Take care.
Thank
Bye-bye.
you.
Bye.
Bye.
Thank you.